that, that's wonderful. But most people can't control that.
If I were to go to a yoga instructor,
Right.
how I would judge them is that they can do all 26 or whatever, 21 moves. I assume, okay, he knows what they're doing. They are a yoga instructor. They're doing it right, hoping that they're teaching me right. But when it comes to our industry, and I wasn't going to talk about this, but it's important to cover this, is our industry. I apologize. Your industry it's not regulated.
Oh, yeah, that's another problem, big problem. BC, it's not regulated. So counselor, which is a very broad word because it just means giving advice. So anyone can be a counselor, and people will not know the difference between someone who just did, went to a college, and in 1 year, I think it takes 1 year to get a degree in counseling. Only it's not a master's; it's just a diploma. So, and they don't have the same requirements and the same training as someone who went through a master's or a PhD. People will not know the difference. They call themselves counselors. They're not registered clinical counselors, but they're counselors because that's anybody who says I'm a counselor. It's okay.
And there's a movement in BC and I remember it was called FACT or something like that.
Yes.
If I got that right.
Right.
And the idea is that they should have a minimum, was it 1 year, 2 years? Sorry, 2 years of schooling or a master's degree before they can call themselves a counselor. Is that correct?
Well, you have to finish a master's degree. It's a 2-3 year program.
Okay.
And you have a certain amount of hours that you have to do of practicums. I think it's 500. So that's a master's. And then if you go beyond that, the next step is a PhD.
And why is it important? Like for me on the outside looking at a therapist.
Because the education that you get from a master's degree, it's not going to be the same as a diploma. Diplomas are offering just a certain amount of education that you're getting. And so it's not the same. It's just not. It's like going to a doctor. Would you go to a doctor for a diagnosis or to a nurse? That's the difference.
Well, when it came to COVID, I talked to my friends from high school that were in an art class. They knew everything. I didn't go to a doctor. That's just a joke. That's just a joke. I went to the doctor.
Right. I mean, it doesn't, just because you go to someone who has a master's or a PhD, it doesn't mean that it's going to be a right fit for you, but you have more of a chance of getting the right responsible treatment than someone who doesn't have that education. That's the difference. Yeah. It's closer to getting the right treatment, especially in dangerous situations like people who are thinking of committing suicide. So the training it's not the same.
No. Then what is the difference? So I was looking into this. There's three here. So what's the difference between the psychiatrist, psychologist, and a registered clinical counselor?
So the difference is that a psychiatrist is a medical doctor. First, they were trained as physicians to become physicians, and then they specialize instead of becoming anything else like a cardiologist, endocrinologist. They wanted to be a psychiatrist, and that's what they did. They specialized in psychiatry, and psychiatry usually focuses more on mental disorders like schizophrenia, psychosis. And they want to treat that, which needs treatment with medication. So they're trained to give, like every physician is trained to give a diagnosis. They need a diagnosis so they can give a treatment with medication. Now, some psychiatrists go beyond that. They, on their own, they choose a school of thought, CBT, existentialism, whatever it is out there. There's dozens, and they go through the training to become what I am, so someone who can provide therapy. But most are not trained to provide therapy. So keep that in mind. They're just trained to give a diagnosis from a mental disorder and treat it with medication. If anyone went through the experience of seeing a psychiatrist, they'll see that. Yes, I'll see you in a couple of months. So it's not the same as seeing someone regularly and talking. That's what therapy should do, is inspire you to talk instead of acting things out, putting things in your body and acting them out in your life, learning to talk about it.
Okay, so touching on that.
Yeah.
Talking about it.